Hello YouTube friends, welcome to my YouTube channel. My name is Lena. I'm a first year medical student in the US. So in this video, I'll be talking about what is in my medical school backpack. But first of all, you might see me wearing this white coat and scrubs and be curious if we actually have to wear this every day in medical school. The answer is both yes and no. So we do wear scrubs on occasions that we have dissection labs, which for us was almost every day in the past 2 months. So I would have 5 pairs of scrubs at home for each week. As for the white coat, we do occasionally wear it. We wear it for student clinics and sometimes for our clinical skills class where we are actually mock interviewing a patient or performing clinical physical exams on patients. And that's where we have to wear these white coats. But that's very occasionally, so on a day-to-day basis, it's usually scrubs or just normal clothes. So I have it right here. This is my backpack for medical school, and as you can see on the outside, there's just a water bottle and a coffee mug. So these are 2 musts that I prepare every day in the morning. And then we have a laptop. And usually I always bring my iPad along with my laptop. The majority of our lectures are pre-recorded, so usually I would use the laptop to watch the lectures and use the iPad to take notes while watching the lectures. There we have this magic keyboard with the iPad, just in case I need to type my notes instead of directly writing my notes on the iPad. So yes, this is my protective case for both of them. My ID badge, of course. I need this to get into all the places around campus. I need to swim myself in. And then we have the stethoscope. So you might wonder, do we actually need to carry around this every day? I would say every week, at least have one chance that we need to carry this, because for our clinical skills class, we always have to listen to heart sounds and lung sounds to practice listening. So this is always a good thing to have on clinical skills day, which happens almost every once a week. And then a pen light. So a pen light, same as the stethoscope. It's almost a must-have for our clinical examinations, and I usually just have it in my backpack. And also an eye clicker. So you might wonder why we have a clicker for class. It's because we have this certain class where we just like sit in groups and teacher presents us with different problems and we use eye clicker to answer the problems. After the first round, we then discuss in groups what answer we chose and do the same problem again after discussion with the group. So this eye clicker is there for us to choose our answers and show it to the entire class. As you can see, I don't have a notebook, I don't have any textbooks. All of my notes are stored in Notion or GoodNotes. If you're curious about learning about those apps that I use for medical school, please check out this video. All of my textbooks stored electronically, also on the iPad. So basically it is very convenient for me to carry around an iPad instead of notebooks and textbooks at the same time. And that really reduces the load of my backpack. As you can see here, this is basically it, like everything in my backpack. There is a pen that I just leave it in there, but I barely use it because once again, I use my iPad for note-taking, even for like sketches. There is this Apple Pencil associated with the iPad. Anything I need to write down, I just write down on the iPad unless electronics are prohibited in certain classes. And I, of course, have my charger for both the iPad and the MacBook. Yes, of course, there is a mask that I carry around all the time, just in case I forgot to bring a mask and I'm in a rush for classes. Tissues are always a good thing to have. And what else? Little moisturizer in case I feel like my skin is too dry. And of course, my keys. Oh my gosh, that was so scary. Okay, yeah, those are like attached to my keys and my cards. This was just like an alarm. Oh my god. Alarm system where if like I'm walking on the streets at night and I don't feel safe or there's some emergency that happened, I could just pull this and it will make that loud noise that you heard and hopefully save me from any kind of danger. The weather gets really dry here, so moisturizer along with chapstick is almost a must-have. I also have this face shield that I usually carry around when I have to do clinical skills, patient encounters. I would put this on as well as a mask. So that's how we do patient encounters right now. There's the AirPods that I carry around with me all the time just to listen to lectures. If I'm in the library, it's always good to have the headphones around. And that is basically it for what is in my med school backpack. Thank you so much for watching this video, and for more content on medical school, how to study in medical school, what life is like in medical school, please like this video and subscribe to my channel for more content as such. Thank you so much for watching, and I'll see you next time.